Widal test. Widal test is a serological test that is done for the diagnosis of typhoid fever caused by Salmonella organism. This test detects the O and H antigen of Salmonella typhi and paratyphi A, B and C. When facilities for culturing are not available, the Widal test is the reliable and can be of value in the diagnosis of typhoid fevers in endemic area. Typhoid fever or enteric fever occurs when Salmonella typhi, S. paratyphi A, S. paratyphi B and Salmonella typhi paratyphi C infect the human body. Body responds to this antigenic stimulus by producing antibodies whose titer rise slowly in early stages to a maximum and then slowly falls till it is undetectable. Persons with typhoid fever carry the bacteria in the bloodstream and intestinal tract, transmitted through the ingestion of food or drink contaminated by the feces or urine of infected people. Thomas Willis is credited with the first description of typhoid fever in 1659, but it was Alexander Louis who first proposed the name typhoid fever. Typhoid fever is caused by highly contagious Salmonella typhi bacteria and spread through contaminated food and water. It is most common in countries with poor sanitation and a lack of clean water. An estimated 11 to 20 million people get sick each year, and between 1,28,000 and 1,61,000 people die. There are 2 vaccines to prevent typhoid. It can be treated with antibiotics, although resistant to antibiotics. Bacteria can be shed by chronic carriers who show no symptom. This is the structure of the bacteria Salmonella typhi that causes the disease. Ingestion. How does bacteria cause diseases? Ingestion of contaminated food or water contaminated with Salmonella bacteria. They invade the small intestine and enter the bloodstream. It is carried by white blood cells in the liver, spleen and bone marrow, and there they multiply and re-enter the bloodstream. Bacteria invade the gallbladder, biliary system and the lymphatic tissue of the bowel and multiply in high numbers, then pass into the intestinal tract and can be identified for diagnosis in cultures from the stool tested in the laboratory. The best known carrier was Typhoid Mary. Mary Mellon who was a cook in Oyster Bay, New York in 1906, who is known to have infected 53 people, 5 of whom died. This Typhoid Mary, she never showed the symptoms of this disease, though she was a carrier of this disease throughout her life. She was considered a carrier because though she did not show any symptoms, she was able to infect other people. So this is how S. typhi works in our body. The mast cells, tight junction, they ingest this. The macrophagic ingestion takes place, but they invade the lymph node, and from blood they invade the spleen as well as the liver, and from liver, once multiplication takes place, they go to the gallbladder and they re-enter the gastrointestinal tract, as there it is attacked by the Peyer's patch, and this forms Peyer patch ulcer. 2 sets of antigens are present. Detection of serotyping. The 2 sets of antigens that are present on the surface of the bacteria, that is helping in detection by serotyping, that is somatic or O antigens, which contain long chain polysaccharides LPS that comprises of heat stable polysaccharide commonly, and the flagellar or H antigens, which are strongly immunogenic and induce antibody formation rapidly in high titers following infection or immunization. The flagellar antigen is of a dual nature, occurring in one of the 2 phases. Diagnosis of typhoid fever is made by blood culture, stool culture, bone marrow culture. Widal test is one, and you have the typhidot, which is a test of ELISA test, and antimicrobial susceptibility test. This viral test, it was developed by Georges Ferdinand Widal in 1896. When the colored smooth killed salmonella antigen suspensions are mixed or incubated with patient serum, anti-salmonella antibody present in the patient serum react with the antigen suspensions to give agglutination. Agglutination, which is a positive test result indicating presence of anti-salmonella antibodies in the patient serum. No agglutination is a negative test result indicating absence of anti-salmonella. The patient serum is tested for O and H antibodies, which are agglutinins, against the antigen suspensions, which are usually stained suspension. S-typhi O antigen, S-typhi H antigen, and S-paratyphi A, B, C, and H. The H antigen is being tested. The paratyphoid O antigen are not employed as they cross-react with typhoid O antigen. H suspensions are colored red while O suspensions are colored blue. No special preparation of the patient is required prior to sample collection. Freshly collected sample is preferable, which is stored at 2 to 8 degrees centigrade for up to 72 hours in case of delay in testing. And 2 specimens of serum are tested at an interval of 7 to 10 days to demonstrate a rising antibody titer. Salmonella antibody starts appearing in serum at the end of first week and rise sharply during the third week of endemic fever. In acute typhoid fever, O agglutinins can usually be detected 6 to 8 days after the onset of fever, and H agglutinins after 10 to 12 days. So the serum sample is taken after this. In acute typhoid cases, it is taken after 6 to 8 days. And H agglutinins, if you are testing for H agglutinins, you are taking it after 10 to 12 days. All reagents are stored at 2 to 8 degree. So this is a commercially prepared widal test kit. 2 methods are there, the slide method and the tube method. And the slide method, which is a qualitative method where you are placing 1 drop of positive control on one reaction circle of test card or on slide, and pipetting 1 drop of normal saline on next circle for which will be the negative control. Pipette 1 drop of patient serum onto remaining 4 reaction circles. So you will have a positive control and a negative control, plus you will be having 4 patient serum. Add 1 drop of H suspension on first and second reaction circle, which is positive and negative control circle, and then add 1 drop each of O, H, AH and BH antigens to the remaining 4 reaction circles. Mix contents of each circle uniformly over the entire circle with separate mixing sticks. Rotate the slide gently back and forth and observe for agglutination macroscopically within 1 minute. So this is how it looks. You have a negative control, you have a positive control, and all these are with the O, H, AH and BH antigens. Pipette out the test samples where this is a qualitative one where you can easily detect the presence or absence. In semi-quantitative method, you are taking in a definite quantity of the test sample on the reaction circles and add to each reaction circle a drop of the antigen which showed agglutination with the test sample in the screening method. Using separate mixing sticks, mix the contents of each circle uniformly over the reaction circles and rock the slide gently back and forth. Observe for agglutination macroscopically within 1 minute. And standard tube method, take 4 sets of 8 test tubes and label them 1 to 8. In 4 you add these antibodies. Pipette in tube number 1 of all sets 1.9 ml of isotonic saline solution, which is 0.9% sodium chloride solution. To each of the remaining tubes 2 to 8 add 1 ml of isotonic saline. To the tube number 1 in each row add 0.1 ml of the serum sample to be tested and mixed well. Transfer 1 ml of the diluted serum from tube number 1 to tube number 2 and mix well. Discard it. Discard the rest. 1 ml of the diluted serum from tube number 7 of each set. And tube number 8 in all sets serves as saline control. The dilution in each set is as follows. So you will have a dilution of 20, 40, 80, 160, 320, 640 and 1000 to 80. That's a dilution that you will be having. To all tubes of each set, add 1 drop of the respective widal test antigen suspension from reagent vials and mix well. Cover the tubes and incubate at 37 degree overnight. Dislodge the sedimented button gently and observe. So you can see based on the dilution, you can see where agglutination occurs. Agglutination indicates positive test result and significant titer is 1 to 160 but varies from population to population. Titer of O antigen more than 1 to 160 indicates recent infection, and titer of H antigen more than 1 to 160 indicates past infection or due to immunization. False positive result may be in vaccination or previously infection with S. typhi. False negative may be due to antimicrobial treatment which blocks antibody response.